Okay, so I'm going to describe to you guys what MTM is. First, let's just talk about the difference between MTM versus Invisalign. Invisalign is a fancy product designed by Align Tech. It uses CT scans of impressions of the mouth or digital scans of the mouth, and those scans are then put into a computer and little teeth movements are done 1/4 millimeter to a 1/2 millimeter at a time. It usually takes maybe 30 steps, somewhere between 20 and 40 steps, depending. MTM is minor tooth movement. It's really for smaller things, tipping, overlapping, crowding, a space between the teeth. So what you're trying to figure out is what constitutes a major or minor space. What would be good for MTM. So let me give you an example. This is a lower anterior arch. You can see they're very crowded. There's some crowding and overlapping, but if you look closely, it's only 3 millimeters. So you say to yourself, well, I could use some force and I could move those teeth 3 millimeters pretty easily using a clear plastic tray. Do I need Invisalign to do it? Well, if it's over 3 millimeters, greater than 3 millimeters, then yeah, you probably do want to use a more sophisticated product. And the more sophisticated product would be Invisalign or something similar. So if you divide up, let's say it's 2.5 millimeters, and you divide that by 10, then that would be 0.25. So each step is 0.25 millimeters. So if you have a 2.5 millimeter space between two adjacent teeth where there's tipping, you could divide that up into 10.25 millimeter steps. And so that shows like maybe a lateral being out in front of a central, and it's just kind of in front of it. So you divide that up, 10 movements at 1/4 millimeter apiece, right? What's a diastema? Diastema is a fancy word for a gap between your centrals. So if you look at a pair of centrals, imagine that there was a big gap between them. You can use a clear plastic tray with some buttons on it, and you can actually drag those teeth back together. Just using some buttons in the tray, they're all clear, and you could use some elastics. So here's what I'm going to do here. I'm going to draw an arch and kind of show you what that looks like. So this is an upper arch as viewed from like a bird's eye perspective. You're looking down over the tips of the teeth, and you can see there's a lateral that's kind of out of the arch. It's sticking way forward, and so what you've got is you've got a lateral that's both rotated and tipped forward. So you block out the inside of the model with some block-out resin, and then what you do is you do a clear plastic tray that you do pressure fitted over the mold, and that mold of the clear plastic tray will fit perfectly on the teeth. It'll snap right to them. The blockout will actually create that space where the lateral is going to move back towards, but in this case, all you need is to apply some pressure. Pressure is effectively what moves teeth. In fact, the best kind of pressure to move teeth is light pressure. So all you need, once you've got a block out on one side, is you make a dimple in the plastic. That creates a force along the facial of the tooth, and that pushes it towards the lingual. Now you can see some overlapping between those teeth. Can you move two teeth if they're overlapped? Well, no, you can't. So I can't just apply force and move it if it's overlapped. So yes, the tipping will be moved by the force. However, you do have to find a way to allow them to move past each other. And when a tooth is no longer touching on the sides and it's kind of overlapping by, say, a millimeter, it requires some IPR. In this case, about 1 millimeter of overlap has to be corrected. So you can distribute that 1 millimeter between those adjacent contacts. So what you can see is there's your millimeter of overlap. And what's the interesting part is, where are you going to get that millimeter without having to disrupt the entire bite? So traditionally with Invisalign, to fix that 1 millimeter of overlap, you have to move every single tooth in the head. If you put brackets and wires on teeth, you have to move every single tooth in the entire head. With MTM, the goal isn't to move every single tooth. The goal is to move a few teeth to correct for an aesthetically displeasing area. So you want to fix a little aesthetic anomaly. You're going to distribute that 1 millimeter over 10 adjacent contact points. So you'll have a contact point between the lateral and the central, between the central and the next central, between the central and the next lateral, between the canine and the lateral. And so now you've got all this enamel on the sides of those. That enamel's, 2 millimeters thick, maybe 1.25 to 2 millimeters thick. If you distribute 1 millimeter of overlap between those 10 contacts, that creates enough space that you can move those other teeth over just a little bit, taking 1/10 of a millimeter on each side of those, and now you've distributed that 1 millimeter over 10 contact points, because you get each side of the contact. That's 1/10 of a millimeter on each side of the contact. That allows for the teeth to move, and then now the teeth will shift because of the force that we were talking about earlier. So before, 10 years ago, if you want to move a tooth 2 or 3 millimeters, we told patients, hey, sorry, unfortunately, you'll have to go through a full case of Invisalign. Or even a minimal case of Invisalign would still cost a lot more than MTM. So today, we're charging people a lot less to do it. So let's say you need to move tooth number 10. That was the tooth I was sort of showing you, a lateral. Let's say it's rotated or tipped. Or number 25, a lower anterior, it's tipped, 3 millimeters. No problem. How many movements is 3 millimeters? You can divide it by 1/4 millimeter. 3 divided by 1/4 millimeter is 12. So you get 12 movements at $150 a movement. That's $1,800 plus a retainer is $300. And so the total cost is $2,100 for a case of MTM with about a 3 millimeter movement. So in summation, the point I'm trying to make here is if you want to move teeth 3 millimeters, you don't necessarily need a full case of Invisalign that might cost, $5,610. You might just need an MTM that would normally cost $2,100. Well, right now I'm including the retainer for free, so now a $2,100 MTM case is only $1,800 during our Year of Jubilee 10-year anniversary special. And that means that you're saving $300 because you get the retainer for free.